From Microbe TV, this is TWiP, This Week in Parasitism, episode 105, recorded on March 10th, 2016. Hi, everybody. I'm Vincent Racaniello, and with me are Dickson Despommier.
Hello, Vincent.
And Daniel Griffin.
Hello, everybody, and to my two co-hosts.
You can say hello. Vincent. Now you can say hello to him.
Wait, let's start again. No, okay, we won't. Hello, Daniel.
Okay, thank
you.
Guys,
summer has arrived here in New York City.
You know, it really has. It's
like
ridiculous.
On Monday, I wore a scarf and gloves, and today it is like in the 70s, right?
Yesterday it was in 76.
It's 24 Celsius. That's in the 70s.
76 degrees yesterday. In fact, it was so warm I went trout fishing. I thought I would be all by myself up in the Catskills.
You weren't?
Sneaking away. You know how many lawyers and doctors found their way up there? Because that's all it can take off.
And doctors.
Yeah, well, they take off Wednesdays.
Well, Daniel is known to sail on the weekends.
This is true, but there were 30 people up there fishing. It was like opening day of trout season.
He doesn't. Maybe this season we could go sailing together.
We should definitely. Well, I was telling the story. I just got off a week of straight clinics, being in the inpatient ward.
Earning your keep.
And, you have all these medical students and residents. You always ask them, what are you thinking about going into? And I made the comment, either they're all interested in going into infectious disease or they're just saying that. So that's what you do. Right. And because obviously, right, sure. I was not this smart when I was training. So when I went to do my surgery rotation, the chief of surgery was the head of our little group. And he said, Daniel, what are you thinking of going into? I said, well, definitely not surgery. And the only thing that saved me was he was also a sailor.
Very good.
So when we connected on that level, it was okay.
Right.
All right, we are going to get you today a case. We're going to solve the case report. We're going to give you a new one, and we're going to talk about shrimps.
Exactly. Shrimp.
Do you say shrimps or shrimp?
It depends. If you're Forrest Gump, you would say shrump.
Shrump?
Shrump. Yeah, that's right.
Shrimps. And so let us begin by hearing from Daniel about the man from Alaska.
Review.
Yes, let us review the case. Case from TWiP 104. It's a young man in his 30s. He's admitted to a hospital in Anchorage, Alaska in early June. His chief complaint is severe muscle pain and tenderness. He's usually a healthy guy, but about a week ago, he had a bad case of diarrhea with belly pain and vomiting. This lasted a full week, and now he has fever, and he's concerned because his wife now has diarrhea. I think we mentioned his wife sent him in.
Yeah.
Sometimes I think we would just die without the smarter half of society to guide us.
Right.
Unremarkable history, unknown family history. He is HIV negative. He had all his childhood vaccinations. He says he does not eat raw meat. He cooks his meat. He doesn't take any medications. He does seasonal work, which actually is not uncommon up in Alaska. He reports being a social drinker by his estimation. And he recently had come back from a successful hunt where he had gotten a black bear. He had, as they say, dressed this in the field. He cooked the meat, but it was well cooked, he tells us. His wife also ate bear meat, and the bear meat is in the freezer. He doesn't like to eat vegetables.
It's okay. He lives in Alaska. They don't have them there.
Well, there's that valley, right?
Partially
huge vegetables.
Yeah, no, in southern.
He also eats salmon, and the salmon he's been sort of finishing off last summer's catch, right. And those have been frozen. He drinks water from the stream when he's out hunting, but from the faucet when he's home. On physical exam, he had an elevated temperature at 38.5 Celsius. Should we let our Fahrenheit people know that's well over 100? His blood pressure is 115/75. Pulse is increased at 105. He's breathing comfortably, but he's a little bit anxious. He's got, as Dickson extracted, swelling around both eyes. We didn't notice any scleral abnormalities. There may have been some nail abnormalities. And we had some labs on this gentleman. His white count was elevated at 14,000, with 30% of these being eosinophils. His blood chemistries looked fine. Kidney function was fine. Now, his muscle enzymes, his LDH and CK were elevated.
What do those stand for, Daniel?
Lactate dehydrogenase.
Thank you.
And creatine kinase.
All right.
People you'd probably be familiar with CPK, maybe some of our older listeners in the audience.
And these are indications that there is muscle cell damage. These are being released from the cells, right?
Exactly.
Daniel, in general, if one has an elevated temperature, is this accompanied by a higher pulse?
Actually, that's a great question. Classically, when your temperature goes up, the pulse goes up, but there are certain diseases where the temperature goes up, but the pulse goes down. This sort of disconnect.
So in general, when the pulse rises with high temperature, is that a response of the body to do what? Bring immune cells somewhere or dissipate heat?
Why are they connected? Why do you get both going? And they're probably driven by the same sort of molecular etiology. But what is sort of the why of it? I guess we're getting at like, how is this helpful?
Right.
And I think that probably makes sense. You think you're infected. I should say the body has evolved with the pressure that it might be advantageous to increase the forward flow of blood during times of infection. I mean, we think of the infections that we see nowadays, but think of the infections that preceded. Wounds, abscesses, skin infections, a lot of different infections where it's helpful to get the immune system to the site of the infection.
Yep.
All right, we have a lot of guesses.
Right, and some of them are encyclopedic in their differential, which I love.
We just these.
We've encouraged that.
Yes, of course. We
and yet
appreciate
the first one.
Appreciate it very much. The first one is from Dr. Girl, who writes, based on the high muscle enzyme results, LDH-CK, I'd guess trichinosis. And then Jerry writes, man from Alaska, trichinella from bear, anisakis from salmon.
Oh, my.
Two. It's got two infections. Right?
Exactly.
All right, Dickson.
Right. Eugene writes, I would say that the patient is suffering from Giardia. Diarrhea and stomach symptoms are the only classic Giardia symptoms, but my own experience many years ago with Giardia taught me that there are very large numbers of possible symptoms which can show up that do not in any way indicate Giardia as the cause. Drinking water untreated from a stream is a pretty good way of getting Giardia almost anywhere in the wilderness. In my own case, I had nearly a week of acid reflux, something I'd never experienced in my entire life prior to that time. I found myself progressively weaker, with a very uncharacteristic lethargy. After the diarrhea showed up, I headed to the clinic to get it treated. The blood tests that were given to me indicated liver and pancreatic problems severe enough that my doctor required that I have a weekly blood test for the next month to ensure that everything was stabilized. As a mountain rescue paramedic, I was very aware of Giardia and its usual list of symptoms. My own did not tick off any recognition.
All right. Daniel, this is our buddy from Hofstra Northwell.
Yes, you got it. Next time you're writing, you got to make sure I'm pronouncing your name correctly. So is it Yosif or Yosef? So let me know so we can get that right. Or Losif, yeah. Let me know. That would be great because I have a track record for mispronunciation, but I was trying to improve. So, dear TWiPanosomes, for this case, my main guess would be the nematode Trichinella nativa. This is a parasite that can be found in uncooked, or in this case, undercooked muscle. Once it is in the GI system, it could be activated by the digestion of the muscle it is embedded in. The larvae then embed themselves in the GI wall and mature into adult worms. From there, they spawn new larvae that use the bloodstream and the lymphatic system to find new muscle to embed themselves into. From there, they wait until new opportunities arise, specifically being eaten by another animal. The infection is usually asymptomatic unless there is a significant parasitic load, in which case there would be a muscle weakness, muscle pain, diarrhea, abdominal pain, etc. The main giveaway from this case, if I am right, is the periorbital edema and the location. I don't know of many parasites that could cause the edema, and the fact that the meat was frozen leads me to suspect that the parasite is resistant to freezing, such as nativa. I would think that you could do an ELISA to confirm the diagnosis, but I would probably get a muscle biopsy since it would offer more certainty, and you could use it to check for other pathologies that I will discuss below. Albendazole would be my choice as treatment. All right, so here we have a differential. Other parasites. Cysticercosis, Taenia solium, could form cysts in muscles, but there was no mention of pigs in this case. Also, there is usually a much more mild response in the muscles and more serious effects from the cysticerci in the brain. Toxoplasmosis. I know that toxoplasma could cause myositis in the acute phase of the infection, as well as the fever and other things, but it shouldn't cause eosinophilia. Microsporidia, a protozoan that is found in fish and could be transferred to humans that are immunocompromised. The symptoms actually match fairly well otherwise, and he does eat fish. Echinococcus. It can form cysts in muscles, which would be problematic. However, it is much more likely to be found in the liver, and there was no mention of contact with dogs. Non-parasitic differential. This is great. That was my comment. That was great. But okay, polymyositis or inclusion body myositis. Definitely not something that you want to miss. I would want to check for any other symptoms such as joint pain, lung problems, lab work of inflammatory markers, and antibodies such as anti-Jo or anti-M12. The muscle biopsy would definitely help rule this out. Hypothyroidism would be more likely to cause only weakness and not pain, more likely to have constipation instead of diarrhea. Dehydration. There was a case over the summer of a kid playing basketball in the heat and having severe breakdown of muscle. I'd expect that this would be more of an acute problem, but I keep it in mind. Electrode abnormalities, in a similar vein as dehydration. I don't think this would present as muscle pain, but I am uncertain of his diet and if he's getting everything he needs. Vitamin D deficiency. This is a major contender. Severe vitamin D deficiency can cause myopathies in a few recorded cases. Living in Alaska, constantly covered up due to cold weather can lead to a severe deficiency. More worrisome is the deficiency of fruits and vegetables in his diet. He does eat fish, though, which usually do have some vitamin D. I would nevertheless check his levels and start him on a supplement for general health if necessary. Mitochondrial myopathy. Unlikely to start this late, but I believe there have been a few cases. MELAS is uncommon, and I would expect neurological sequelae, but I would keep it in mind, especially without a family history. Bacterial abscess. I don't recall the muscle pain being localized or generalized. A localized pain would make this more likely. I'd get a blood culture, especially since his temperature is elevated. SLE, because it can present as anything. A few more thoughts. Myotonic dystrophy type 2, sarcoidosis, acute infarction, and any drug-induced myopathy, although I know he is not on any drugs currently. Sorry, I got a little bit carried away. This was great practice for me, and I hope you enjoy having a broad differential. And it's an MD candidate at Hofstra Northwell School of Medicine, class of 2018.
Nice.
Do you like having a broad differential, Daniel?
I like that. And to soon to be, I guess, Dr. Davidoff, because I feel like I'm more comfortable pronouncing his last name. I actually had the first graduating class of Northwell Health graduated students in the spring of this last year of 2015. And one of those students was an intern working under me the last 2 weeks of the hospital. And I was impressed, and I'm impressed by this email.
Yeah, getting good training.
They seem to be doing it right out there so far. This is a small sampling with an N of 2.
This is true, but maybe they only have an N of 3 total. Who knows?
We'll have to see.
Next one's from Heather, who writes, "Hello, doctors. Taking a break from grad studenting and my normal day job, during which I have managed to turn my fingers purple with crystal violet, to share my thoughts on the latest case. This isn't really a true differential, mostly what went through my head as I was listening. I hope it didn't hurt." You get it, Dickson? Went through my head?
I got it.
Since this was an Alaska case, salmon poisoning came to mind, but since the patient isn't a canid and I am unaware of ocular involvement in salmon poisoning, I decided to tentatively rule out Neorickettsia helminthosa. Helminthoisa. How would you say that? Damn it. Dickson?
Helminthoca.
Helminthoca? Okay.
Yeah, Helminthoca.
I will also rule out brucellosis since this is TWiP, but it did cross my mind because of the contact with game meat. I think this is more of a pig and ungulate disease, though. Not sure about bears. By the way, those of us who dress wild game usually wear armpit-high disposable gloves to lessen the chance of catching something fun like brucella and leptospira. Yeah. I even bring a plastic apron out in the field with me. Oh my gosh, Heather is a hunter.
Sounds that way.
You know, you can't tell on the internet what people are.
You cannot.
Yeah, I'm now getting a visual of this woman, in the gown and the plastic
Gosh.
gloves up to her armpits. So.
Is brucella a pig and ungulate type of thing, Daniel?
So brucella, actually, it's funny when you go out west. You hear people start to talk about brucellosis because they're worried about it in the elk population. And I have a colleague in the Middle East where it's an issue in camels. And it's an undulate.
It's named after Bruce, by the way, who also had something else named after him.
Brucei. Trypanosome brucei. Wow.
Yeah.
We hunters, I say this like I have time to hunt while grad studenting, but are also concerned about Dickson's favorite parasite, Trichinella. I personally do not eat bears, but we absolutely do not eat fresh wild pig meat in our household. It goes in the freezer first.
Right.
Cooking wild game to safe temperatures can be hard because wild animals have a lot less fat, and the meat can dry out much more quickly than that of domestic critters. Bacon is a commonly used adjuvant in this situation, since Trichinella spiralis is the only parasite I can think of, by which I mean Google lazily, that has the gastrointestinal, febrile, muscular, and ocular involvement and is known to be present in Alaska bears. That is my guess for this week. I must now go run the gauntlet of potassium permanganate, potassium chromate, and silver nitrate, and try not to turn myself any more interesting colors. P.S. Can we please have a fungus case study? Fungal pathogens are technically parasitic, in my opinion. Well, next week we're going to have a fungus case, a fungus paper, actually.
Oh, so
in 2 weeks, the one I sent you.
So maybe I should.
One?
Maybe I have many fungus cases.
Okay.
It's a whole new world.
So consider that a hint. There might be I might do a fungus. Not this one won't be, but maybe next week I'll think about it.
Dickson, you're next.
Sure. Dear TWiP amigos, it is such an honor and pleasure to once again send in a guess for the case study. Me and my girlfriend were thrilled to hear our guess of African sleeping sickness was correct, and we hope the patient recovered quickly. As for this week's unbearably parasitic case study, little pun intended there, we would like to venture a guess that this patient has contracted a case of trichinosis caused by trichinella in the bear meat. Although the hunter does, that's what it says.
What is doze?
Doze is bear meat.
Froze. Must be froze.
It should be froze. That's probably right. Well, I don't know. She was doing plays on words over here, so let's, I don't know. Or he. It takes a considerable amount of time to kill the nurse cells within the muscular tissue. The correct method for destroying the parasite is rather to cook the meat at around 140 degrees Fahrenheit. But we are not so sure of how temperature the bear meat should be cooked when the hunter and his wife
We're not
meet.
sure of
We're not sure
how
of what
high-
the temperature
how
was
high.
when they cooked it.
Yes,
Right.
exactly.
The symptoms of diarrhea, muscle pain, tenderness, fever, and periorbital edema are all indicative of infection by trichinella, as well as the results of the surge in eosinophils. Elevated CK, LDH levels are also consistent with trichinosis. We'd also like to correct a critical error in last week's episode. Wilson was a volleyball, not a basketball! Exclamation point. And they actually sent a picture of this. Thank you for the podcast and keep on twipping.
Actually, we have another letter later with a picture.
Okay.
Because we had
What
two
else?
emails about that.
Okay, these egregious errors that we're
Egregious. That's right.
Yeah, they are egregious.
Elise writes, Dear TWiP Trifecta, how are you? Lower Manhattan in early March is windy with a steadily plunging temperature.
Look at that.
And we'll update. Is now
That was
It
yesterday,
is now
or day
steadily
before.
shot up.
That's right.
So when she wrote this, it was -3 Celsius.
And now
It was like last week.
It's great.
Isn't that amazing? It was in
Yeah,
the
it's really
20s Fahrenheit, -3 Celsius.
Now it's going to get cold again, isn't it?
That's true. It should.
The Alaskan patient's symptoms, when presented as a collective, do seem to point in an extremely parasitic direction, especially in light of where he lives and his diet. However, in the interest of a differential diagnosis, I'll cast a wider net. His symptoms initially resemble a particularly horrible bout of food poisoning, but as the week progresses and his symptoms shift, they come to resemble the most likely parasitic suspect and some other potentially more challenging infections. The patient's fever and severe myositis could indicate a viral or bacterial infection. Among the more frightening possibilities I thought about were streptococcal myositis or staphylococcal aureus myositis. These conditions progress extremely rapidly, though, and the patient would probably not have survived long enough to wait for his wife to send him in for medical treatment as he did. Another possibility that I thought about was Lyme disease. Lyme symptoms can often resemble the patient's complaints, particularly if they've been combined with something like food poisoning. Having said that, the Alaskan patient almost surely has become infested with trichinella. We do know that he has a parasitic infection, but even without this prior knowledge, the progress of his symptoms, starting with nausea, abdominal pain, and vomiting, and progressing to intense muscle pain, periorbital edema, changes to his fingernails and eyes that Dr. Griffin didn't describe, but which he did indicate were present when Dr. Despommier prodded about them, all suggest strongly that the bear meat wasn't cooked quite as well as the patient had hoped. A quick search revealed that bear meat in Alaska is a tremendous source of trichinella. I do wonder why the patient's wife is experiencing symptoms a week later than the patient. Does this couple regularly not cook its bear meat thoroughly so that each ate a separate meal and became infected at different times? Does she have a different infection? As always, thank you so much for your work and your wonderful podcasts.
Great questions at the end.
He had to prod you for these key symptoms.
Well,
but that's okay. Even the hunting you hadn't included.
He's leading the witness.
I asked you that.
That is true.
But that's fine. That's our function here.
I guess.
The next one's from Eric, who writes, Dear TWiP Triumvirate, thank you for another fun case of the week. The signs and symptoms in patient history all seem to point trichinosis, recent acquisition of fresh bear meat, check. Diarrhea, fever, abdominal pain, check. Edema around the eyes, check. You did want a differential, so one could also consider giardiasis or cryptosporidiosis, although these would not explain the wife also getting sick since she was not on the expedition. It is sunny and 60 degrees here in Seattle, a beautiful March day.
Wow.
Dickson, you are next.
Okay.
It's a very long one, Dickson.
It certainly is. I'll try my best.
Please.
Anne writes, TWiP 104. Hi, TWiP team. My thoughts for the case of the man from Anchorage with diarrhea followed by myalgia with eosinophilia is very hard not to leap straight to trichinellosis. Trichinellosis. Properly written, by the way. Trichinella spiralis infection. As so many things fit consumption of black bear meat, albeit reportedly cooked but adequately. Clinical course of diarrhea and vomiting, intestinal stage, followed by the muscle pain, fever, periorbital edema, myopathic stage, and blood work revealing elevated white cell count, eosinophilia, and elevated LDH and CK indicating muscle damage. However, Manuel specifically asked for a differential list rather than a single stab at the diagnosis. Concentrating on a differential diagnosis list for eosinophilia as a differential diagnosis lists for diarrhea and vomiting, fever, elevation in white cell count, etc., seemed too nonspecific to be useful/efficient. I am ruling out the majority of the non-infectious causes of eosinophilia for the entire inappropriate reason that the case was presented on TWiP. So I threw out allergy, neoplastic disorders, hypereosinophilic syndrome, and hypoadrenalism. Infectious causes of eosinophilia: helminth, strongyloides, stercoralis, hyperinfection, GI signs, fever, abdominal pain, but not usually myalgia, toxicara, visceral larva migraines, more likely to occur in children, can cause fever, malaise, nausea, and vomiting, anorexia, and myositis, GI signs not predominating, hookworms, Necator americanus, abdominal pain, nausea, fever, but generally no muscle pain/myalgia outside of classical geographic range. And it's outside of the classical geographic range, too. Trematodes, paragonomyosis associated with ingestion of crabs, crayfish, pulmonary infection, Nanophytes salmonicola, trematode acquired through ingestion of salmon and related fish, causes diarrhea, eosinophilia, nausea, vomiting, and fatigue. In dogs, it is often fatal, as the flute carries the rickettsial organisms, Rickettsia helminthica. This would have been a stronger differential if the patient had been a dog. Protozoa. Cystoisospora belli.
Yep.
Used to be called
Isospora.
Used to be called Isospora belli. GI signs, but no muscle involvement, usually tropical. Sarcocystis species can cause both intestinal and muscle syndromes in humans, but not both. It seems, and reports are primarily from Asia. Fungi. Coccidioidomycosis. Coccidioides immitis, usually endemic to southwest U.S. Global warming hasn't extended its range to Alaska yet, ? Aspergillus, Basidiobulomycosis, paracoccidioidomycosis, disseminated histoplasmosis, and cryptococcus, also associated with eosinophilia, but not usually associated with GI signs and myalgia. I ended up with trichinella still being at the top of my list. I did find a reference to that. Stated T. nativa in Alaska bears and walrus meat is cold resistant, although this case did not hinge on whether or not the meat was frozen. And this is from an MD and a DVM together.
I don't think so.
PhD DVM.
I'm sorry, I'm sorry. You're absolutely right. That's right. A DVM PhD from Beaverton, Oregon.
Wow.
So that's a wonderful differential way of looking at it, but so we'll come back.
All right, there's one more, Daniel.
David writes, Dear Triumvirate, when I took Dr. Racaniello's Coursera Virology 1 course, I started listening to TWiP out of curiosity. It must have been around episode 238 around that time. Contagion was almost instantaneous.
Wonderful.
Absolutely no incubation period.
See that, Dickson?
I am an electrical engineer, but have been working in education and software development ever since I graduated, and I have no biology degree. Nevertheless, words like biochemistry or immunology always seemed surrounded by a glamorous, mystic aura. Having started with an old physiology textbook, a botany manual, and a book on neuroscience some 5 years back, TWiP really pushed me over the edge with its wide variety of science gems, launched us on a weekly basis. I listen almost daily, generally at the end of the day, but also while doing small maintenance tasks in the house like painting. After TWiP 75, a glorious episode with Bobby Pratt, something went wrong with my mail subscription, and I sadly regretted that Dr. Despommier was probably busy traveling while diving into TWiM and going through the TWiP catalog. Around New Year, I found out that TWiP had just continued and upped the stakes by including diagnostics, and great was my joy. While listening to the last 20 episodes, I felt taken aback and intimidated, even after listening to all TWiP episodes and taking the Coursera course on parasites. Even professionals sometimes get it wrong, and I felt powerless. This week, after listening to some eosinophil-related episodes, I decided that I would have no rest until I got to the bottom of this. So here is my diagnosis. I go with trichinosis as the diagnosis for the case because it fits so well. The bear meat was a giveaway to begin with, recalling the stories of polar explorers when trichinella was initially discussed. I actually started my diagnosis with eosinophilia because I am practically clueless at all how one should diagnose a patient. Keeping in mind Dr. Griffin's warning that TWiP could also include non-parasitic diseases, I checked the non-parasite options first. I found lists of allergies that I discarded because of the generally very healthy state of the individual, and the fact his wife got infected too excluded these. Then there were the eosinophilic primary diseases, but these I also excluded because there obviously was something else going on. Tumors like leukemia and lymphoma also got excluded based on their non-infectious nature. For the rest, as the patient was HIV negative, and the other options seemed rather far-fetched, I turned to the main dish, the parasites. The highest eosinophil count excluded most non-helminths, except for Dientamoeba fragilis, Isospora, as we now call Cytoisospora belli, and Sarcocystis. Dientamoeba appears to contaminate through water, which the man drinks from the stream, so this was an option, as it causes diarrhea and fever, but it seems to focus mainly on lower intestine, while the victim also displays elevated muscle enzymes, pointing toward a tissue breakdown. Isosporiasis is less realistic as it transmits fecal to oral and mostly attacks the immunocompromised. Sarcocystis appears to be an option. It is caused by undercooked meat and leads to diarrhea and vomiting. And Wiki tells me it also has elevated CK levels associated with it. However, the time of the initial sickness is only 36 hours, while it lasted a week for our poor hunter. Then, for the most common helminths, Ascaris, trichoriasis, strongyloidiasis, and tapeworms did not seem to match the symptoms well enough. Filariasis could be excluded because we are talking Alaska, as well as schistosoma. I must say I did not check geographical distributions thoroughly, mainly because I could not find them, but these are tropical for all I know. Then there was the wiki on trichinosis, which had it all. The edema around the eyes, the muscle pains and muscle weakness, Larvae travel to the myocardium and the skeletal muscles. This should explain the tissue breakdown leading to CK. Conjunctivitis and retinal hemorrhages featured among symptoms. That explained why Dickson asked about it. The CDC image for Trichinella spiralis nicely includes the black bear. I must say it is quite a thrill to have more than an educated guess, and although I may be wrong, I am just happy that I managed to wade through the symptoms to come up with a reasonable diagnosis. I guess the diagnosis can be confirmed by using a microscope to have a look at the larvae. Treatment should probably be the miracle drug albendazole or mebendazole. Prednisone is mentioned to help relieve muscle pain. So here's my guess. I did not make wrong inferences, but the case seems to have Trichinella written all over it. It is a pleasant 33C in Jinotepe, Nicaragua.
Ah.
And I send you my regards, thanking you for all these wonderful episodes and those to come. Regards, David. And we have a PS. I was initially thrown off by a document I examined, Intestinal Parasite Guidelines for Domestic Medical Examination for Newly Arrived Refugees of the CDC, which does not even mention Trichinella as a parasite causing eosinophilia. I still wonder why that is. Is Trichinella not an intestinal parasite? The larvae do hatch in the small intestine, or is it because of the geographical distribution, with the U.S. rarely receiving refugees with Trichinella? All right.
Good bunch.
Fabulous answers.
Those were some great emails.
Yeah, I like how they responded to Daniel's call for a differential. How about that?
That's great.
Yeah, people put time into this, Dickson. You notice?
You do.
You should consider that.
Vincent, you should be nice to Dickson.
Should be. Where is he?
He's traveling the world right now, I guess. I don't know.
So most of the guesses were Trichinella.
Yep.
And what else do we need to know, Daniel, before we can make a conclusion to this interesting case?
Let's see. Do we know any? Do we need to know anything else? Did you feel like you needed to know anything else, Dickson? Did you want any diagnostic tests, or you feel like you're good to go and you're just going to throw some treatment at this gentleman?
I'm good to go.
Yeah, you would treat him based on what you know, right?
Very good to go on this one. Yeah,
This
is a classic case, but the other classic aspect to this would have been to ask whether or not he shared that bear meat with anybody else, and are other people sick in the community, because you start to see the effects later on down the road from this one gift, in quotes. Dr. Harold Brown, my mentor, used to say, "Beware of Greeks bearing cysts." And he meant that for the Conococcus story, but in this case, beware of anybody bearing cysts. So the bear meat bearing cysts, so to speak. So there are classic cases of where a community purchased, let's say 10 or 12 people, a pig for Christmas and brought it home and divvied up the pieces and distributed it throughout the families. And there were massive outbreaks of Trichinella, traceable back to a farm up in Ulster County, New York. Mm-hmm. And the CDC went up to that farm and they questioned that farmer again and again and again as to what his practices were, and none of them involved feeding raw garbage to the pigs. And he could not figure out, this investigator could not figure out how the heck Trichinella ever found its way onto the farm until he spotted pelts nailed to the barn door of wild animals that were caught trapping. Mm-hmm. And the penny dropped us, so to speak. And he says, "Oh, and by the way, what did you do with the carcasses of those animals that you trapped?" And he says, "Oh, I fed them to the pigs." Yeah. Oh, that's where it came from. So the sylvatic cycle of Trichinella, which involves non-domestic animals in the like wild bears, for instance. And by the way, in Alaska, bears feed at the garbage dumps all over Alaska. So that's a common source for this infection, eating meat scraps left over from other people's garbage, basically. Or if a bear dies, that carcass is consumed immediately. And that's going on even more now with polar bears because their habitat is being threatened by global warming events, as you know. But the other thing you could do is, of course, ask for a muscle biopsy and look for the muscle larvae, which would be very difficult to find in most cases because they're not all in one place. They're sort of scattered throughout the muscle tissue. So your chances of finding one might or might not be good. If you took enough muscle, you might consider macerating it and doing a PCR to just demonstrate that the genome is there. And that's been suggested for checking pigs as an online inspection system. But for people, I think you've got enough data here to go ahead and start treating. So, and in general. They did. So what did they do?
All right. Well, let me address people's differential because I like that. I mean, people are good about that, and I'm going to compliment everybody because in a lot of ways that's what makes medicine fun. I mean, a lot of times you can say, I've seen this, I know what that is, and you go forward. Not only do you lose a bit of the fun, but every so often you're wrong because in general, if you don't think about something, it decreases your likelihood of actually making the diagnosis.
This right, by the way, because that's coming more and more common practice for physicians. They don't even do this; they just give it over to Watson, and Watson takes care of it for them. And that's not a joke anymore. That's actually true. So that's a big danger here, right?
So there were a couple ways to approach this case. So I noticed some of our listeners said, "Okay, I'm going to start with eosinophilia. I'm going to start with the fact there's a lot of eosinophils."
Great.
And what causes eosinophilia? So that was the one differential. And I think I mentioned on one of our prior episodes that there are these mnemonics. There's so many things you're trying to remember in medicine, and to help you remember them, we often create these mnemonics. So the one, the eosinophilia mnemonic, is China, China. And so what does that stand for? I mean, we're in parasitology, so we kind of cut to one of these, but C is connective tissue diseases. So there's a number of we'll call autoimmune or immune dysregulation issues. Scherg-Strauss. H for helmets.
For helmets.
Yes. I is actually, they say idiopathic, but I also throw infectious in there because, maybe it's something other than just, and I think some people mention in some of these severe bacterial infections, you can actually get myositis. But idiopathic also, but also that throws in the random things, the dehydration, things that, and neoplasia.
Right.
And there's particularly blood neoplasias, so your lymphoid malignancies, and then allergies. And a lot of these can be drug responses.
Sure.
So that was one, you sort of went through that. And so we had our helminths being considered there.
That's right.
And then we also had another clue that I waited for Dickson to extract. I don't know, did I wait for Dickson or I sort of throws? But this was the periorbital edema.
You extracted it, right? Yeah. It's a giveaway.
Yeah.
Well, there's a list of things that cause.
There are too many things that cause.
In our world of parasites, we think of trichinosis, but also acute Chagas can give you a periorbital edema.
It can, but it's not bilateral. You see, and that's the whole deal. When I asked you, is it bilateral periorbital? You've got to be very specific about that because Chagas can give you the chagoma, right? But it's only in one eye. It's never in two eyes, whereas this is always in both eyes.
Yeah, and that's actually with a lot of these, like the periorbital cellulitis is going to be one side. That's right. So this classic bilateral periorbital edema, when it comes to parasites, you start thinking.
It's not pathognomonic, but it's pretty pathognomonic.
So the Chagas is when you would infect yourself.
That's correct.
Here it's many days after the ingestion.
And there's a larval tapeworm.
What causes the edema in this case?
Well, it goes into the tissues first, and then.
So you actually have trichinella in your eye?
Not trichinella. Oh, you mean what causes the edema for the periorbital edema?
Yes.
Oh, it's going into the muscle, and you're getting a lot of tissue damage, leakage of vessels
around
basically.
Your eye.
Well, everywhere, but you can see it primarily around your eyes better.
You see the tissue, but there are no trichinella around your eye muscles, are there?
I think they're actually
they are.
They're actually in the eye muscles.
So they're everywhere.
They are everywhere.
Really?
They are everywhere. And the other thing to watch was a rebound effect. Okay, they do this. They press on your flesh, and they just see how fast it bounces back to normal. In this case, it would take a while because it's filled with fluid. N'est-ce pas?
So here we had these wonderful clues, and they're all pointing to trichinella as our culprit.
I would have loved to have seen
splinter hemorrhages
in the fingernails, but maybe they were so dirty after cleaning that bear that you wouldn't have seen them. Maybe.
Yeah, sometimes it's actually hard to see what you're supposed to see.
Yeah, that's true.
Patients don't always cooperate. But here we are in the modern world. So two diagnostic tests were done in this case.
So I must say that, just to interrupt one more time.
Interrupt away.
Every time you leave our discussions at the end and you give a website, one of them is trichinella.org.
Yes.
If they go to trichinella.org,
yes,
there's I think, a well-prepared clinical summary of trichinella with all of these pictures right before your very eyes so that you can actually see them.
You know, Dickson, I'll bet none of our listeners went to trichinella.org.
But they probably should have, because Because if you click on the clinical,
Yeah, I see clinical summary.
and then you can see pictures of periorbital edema and fingernail bed.
Major
splinter
clinical
hemorrhages.
findings. So let's go through some of these.
Sure.
CPK,
Right.
muscle larvae, eosinophilia is a big one.
Yeah.
Bilateral periorbital edema,
There you go.
conjunctivitis, fever, muscle pain, diarrhea, nausea, vomiting. And it's got a time course of
It's
these.
got a time course on it.
All right.
That's right. And this has been requested by a number of other publications. We're very proud of having put that together.
Yeah, it's from day 1 to 1 year. And
Yeah.
you know what? The muscle larvae are going out to a year.
They are, and even longer.
Wow.
And even longer.
And the reference here, number 1, Capo and Despommier, 1996, clinical aspects of infection with Trichinella
Yeah, it was a
species.
review we wrote. But there are some pictures there, too, I think.
Oh, yes, there are lots of pictures. Lots of pictures. Not in this clinical presentation, but we got muscle larvae
Right.
pictures. Oh, some of these links are broken, Dickson. I'm going to have to fix them because I'm your new webmaster.
Okay, well, let's fix them.
I have to fix this. Oh, here's a picture of a guy with conjunctivitis.
Yeah, that's right.
Splinter hemorrhages.
See.
And clinical is spelled wrong. It's clincele. That's common.
Oops.
Dixon, what causes the splinter hemorrhages of the
Same
finger?
deal. The larvae have to exit the blood in order to get into the muscles.
This is so disgusting. You're full of parasites. Oh, my
And then,
gosh.
I mean, imagine all the microhemorrhaging that occurs all over the body.
But we're full of viruses, so what's the big deal?
We are.
Right?
In fact, Trichinella can carry them. They carry lymphocytic
Dixon, what virus has infected every human on Earth?
the virus that's infected everybody? I guess it's rhinovirus now.
No.
Something different.
One family of viruses has infected every human on the planet and will do so forever.
You're stumping the stars
Because
here.
it's in your genome.
Oh, I see.
The retrovirus.
Oh, retrovirus.
All 7 billion people have
My goodness.
retroviral DNA.
Okay.
Isn't that amazing when you think of it
truly
that
is.
way?
No, it truly is.
I digress. So let's go
No,
back to
it's fine.
Trichinella. Is it really Trichinella?
Well, we did a couple tests because I'll tell you what the tests show, and then you tell me what you think. We did a serology. We did an ELISA looking for antibodies to Trichinella. And I guess we can go to the Trichinella page and try to decide, based upon the time course, are these going to be positive at this point, right?
Good point.
Because that's an issue sometimes, and I think people need to think about that.
Right.
If you test too soon,
Yeah.
let's say you tested,
That's right.
boom, right at the first week. But by the time this guy gets tested,
Yeah.
about 2 weeks into this,
Could be
he
okay.
finally gets it done. And at that point, yes, he's antibody positive.
There's a ton of varieties of tests out there.
There are, and actually, there's an antigen test for Trichinella that you can do. You can actually do a serum antigen. That wasn't done in this gentleman, but there's a window when the antigen becomes positive and the antibody is also positive, and so the antigen comes up, as you might expect, a little bit earlier. So you're getting the exposure, and then boom, you get an antibody.
Right.
So this person, though, had a positive antibody test for Trichinella.
Right.
Who knows? Maybe he got it before. How do we know it's right now? How do we know?
The other thing I meant to mention here is
An IgM?
what is the eosinophilia due to?
Oh, yeah. Wait, can I ask him about
Oh,
the
yeah,
antibody?
absolutely.
Is it an IgM test or IgG? Must be IgM, right? Because it's early.
Well, it's 2 weeks in, so you're already going to start to get IgG.
Yeah, you will. So what do you think is inducing the eosinophils? Which stage of the infection?
Are you asking?
That's a general question I'm throwing out
who
to
are
the audience. But the two listeners that are live on stage here.
the live listeners.
Yeah, the intuitive answer based on other helminthic infections would have been the larva, because it goes all over the body, like in lymphatic filariasis, for instance. But it turns out not to be the case.
It doesn't peak with the larva on your graph.
Not to be the case. That's right. That was a tip-off. And most people didn't really click to that in the beginning of these clinical investigations. And so they always blamed the eosinophilia on the larvae migrating out throughout the body. But in fact, it turns out to be due to the adult worms in the gut tract. So if you can drug out the adult worms in an experimental infection before they produce larvae.
Drug them out. You made a verb out of that.
Right. Which is day 5, prior to the time after they mate, but before they produce larvae, you'll still get an eosinophilia in those animals. And if you inject the newborn larvae directly into the muscle, there's no eosinophilia that results from that.
Very nice pictures in this
Thank you.
website, Dickson.
Thank you so much.
I'm taking care of this for you now.
I do know.
I should correct some of
eternally
It needs to be all fixed up.
I have to fix it.
Brought up to
Very
modern.
nice pictures.
Thanks.
Yeah, you want me to modernize it?
Would you please?
Yeah, I could do that.
Yeah, I'd love that. And everybody else would too, by the way.
Do you think anyone goes?
You can tell. I have a website counter. I get about 600 or 800 visitors a day.
It's copyright 2000. Copyright 2004, Dickson.
No, I know it's out of date. No, you're laughing at me. Everyone laughs at me, but they laughed at Christopher Columbus.
Some of these links are broken.
Did they laugh at him?
But ho, ho, ho. Who has the last laugh now?
I don't know.
The song.
But
so
they did something else. They did something else.
Mm.
They actually did a muscle biopsy.
And
they did a biopsy of the left deltoid near the tendinous insertion. And what did they see at this point? We're about 2 weeks in. What would you see at 2 weeks?
Nothing. Not a darn thing, because the larvae haven't matured yet to the stage where you can actually see them.
Yeah.
So they're a little sausage stage, and then you won't see anything then. So,
so it takes.
They might have seen some beginnings of the foci of inflammation around the development of the nerve cells. They might have seen that.
Yeah. So the fortunate thing is we're in the modern world, and it takes a little while before the biopsy actually gets performed. Right? Which is good, right? Because you order it, but who's going to do this? And you got to get him in, and they got to evaluate him. And then biopsy. So by the time he eventually gets his biopsy, there actually are early stage larvae.
Yeah, cool.
Okay.
So the deltoid, that's up here?
But we're sort of, the deltoid's your shoulder muscle, right?
What is it, on top or on the side?
So it's actually, if you let's say you went off come down, just as you start to come down off the peak of your shoulder, that muscle
it's
right
sort
there.
Of where you would get an injection anyway, right?
It's where you usually get injections.
Okay.
Those shots. But here, you got to realize, before that biopsy comes back, there's this whole discussion, should we treat the man? Should the man be treated?
Yeah, that's right.
And it's an interesting issue. What would you do, Dix? What are your thoughts? Being one of the world experts on trichinella.
Sure, I would have immediately gotten his wife in hospital too and performed certain other tests on her as well. You can actually find adult worms in the stool if you look hard enough for them, because they don't last forever. They produce their larvae over a 2 or 3 week period, and then they pass out. So you might have been able to find a few worms that way, but probably not. But if her course of infection mirrored his, except it was just delayed by a week, I would have certainly asked her, when was the last time you ate bear meat? And she said, well, I didn't eat much, the time we caught it, we killed it, because I wasn't very hungry that day. But about a week later, boy, did I get hungry, and I pigged out on that. So that sort of thing. But I think that as a physician, and I'm not, I would have recommended starting to treatment, because I think that that's pretty classic trichinellosis. So if you give steroids and you're wrong, which is you should start giving steroids, because there's something called innocent bystander effect, where the muscle larvae damage the tissue, but then the muscle cells next to it also start to get affected by it, and that's where the swelling comes from and that sort of thing. Steroids actually quell those reactions, and it makes the patient feel better. And it doesn't do anything to prolong the infection or anything else. It just, you're giving it at very low doses, but just enough to keep down the inflammation so that they don't suffer as much as they would have if you hadn't. But if it's an infectious disease that's triggered by giving steroids, so you're inhibiting the immune system and it starts to get worse, then you're going to be in trouble.
Right.
So that's what you have to weigh, one way or the other. It would have been nice to have the wife with similar symptoms at the same time, because then you could have made a diagnosis based on 2 people having the same thing. The odds are that it's going to be trichinella rather than something else. But I would have started.
Yeah, no. So fortunately, he had eaten the bear meat, and then there was a gap of a week before she first ate the bear meat. So that was consistent. And in this case, this gentleman was treated with both albendazole and steroids. And they've studied this, fortunately. It's always nice to have some evidence to guide you. And it appears that treatment with albendazole, coupled with steroid treatment, actually decreases the period of time that you have muscle pain and also the severity of the muscle pain.
Right. And so there's another drug related to albendazole called thiabendazole. It's an older drug, and it was produced by Merck. It's effective against the adult stage. So if the wife comes in still harboring adults, but prior to the time when they have produced maximum numbers of larvae, thiabendazole could actually be used to cure her if they had thought about it. So that was another possibility, because in those animal studies that I mentioned before that we conducted, we used thiabendazole to shorten the lifespan of the adult in the gut tract to show that prior to the time it produced larvae, you still get an eosinophilia. So that drug is still available out there. You can still find it. And so that would have been an interesting different therapy to offer to the wife rather than to husband, just knowing what the timing of the infection is all about.
And was the outcome good?
They both did. They both did fine.
Very good.
They both did.
Apparently, he had a lot of larvae. He must have eaten a lot of bear meat.
Big guy.
That's an interesting. I remember your story that you shared with me more than once, I think, about the initial discovery of this. How this was actually quite prevalent in Europe, and that the sandy diaphragm story.
Right.
So it's sort of an interesting thing. Like, do people keep getting infected? Do you think that people develop an immunity? Do you think all those people with sandy diaphragms had a massive initial infection?
I do. I absolutely do, because there is a permanent immunity that results from prior exposure. So that you could eat as much as you want after that and nothing would happen.
So this guy's now set. He can start eating his bear meat.
He could eat raw bear meat. So in case he had an enemy, no, we won't even go there. We won't write that science fiction story, but yeah, Trichinella infection, if not lethal, offers protection against lots of other things which require either Th1 or Th2 responses to be elevated. And so the story that I like to tell is the one about Yul Brynner, the actor, who, together with 3 other people eating at Trader Vic's in New York City, acquired trichinellosis by eating spare ribs that weren't properly cooked.
Are we going to get sued? Has this been?
No,
this is verified.
Published, everything else, and he settled with the restaurant for about $125,000 lawsuit that they leveled against this restaurant for serving them trichinella-infected pork, which they, of course, didn't have no knowledge of how to diagnose that either. So they were innocent. The producers of the pigs were the ones that should have gotten this. But Yul Brynner later on, pardon me, went on to develop a sarcoma due to smoking. It took him 9 years to die from that, whereas ordinarily a person would have died within months. So this heightened his immune surveillance, we think, to the point of being able to keep that cancer in check until it finally overcame that.
Can you be infected again?
Well, animal studies suggest no, you can't. And the reason for that is quite interesting. It doesn't relate to protecting you against another lethal infection with trichinella. It favors the spread of trichinella. so you're going to say, well, how does that work? Let's say that you're a wild animal and you just acquired trichinellosis and you've now harbored the larvae in your muscles, but it doesn't affect the way you behave. So you migrate away from that site. And the next thing you know, you eat another carcass that's just loaded with trichinella, right? In nature, coprophagy is very common. And we would call this a barnyard infection. If you were to look at the domestic pig situation, in which one pig or maybe several pigs are totally immune because they've already caught the infection and now they're not going to die again, all the other pigs that have yet to catch it, when these pigs start to eat from a carcass, let's say a rat or a mouse that they catch, and they do that a lot on the barns, that pig that's had trichinella passes all those larvae, and they're all infectious for the next animal if they consume the fecal pellet or the mass that is secreted by these animals. And it's called rapid expulsion. And it's a whole phenomenon about the second time around. The immune system doesn't even wait for the adults to be produced. It senses the antigens from the prior infection from the larval stage this time, which is constantly in the muscles, and out they go. And it's a totally different immune mechanism than gets rid of the adults in the thing to begin with. And that work was championed by people working at Cornell University, your alma mater, Judy Appleton and Robin Bell.
We talked about them recently.
And
we
others
did a paper of theirs recently.
Yes, we did. Yes, we did. So they were the ones that worked on rapid expulsion in rats, but we also assume that the same immune reaction occurs in pigs as well.
Dickson or Daniel, do either of you know why this CDC document, Intestinal Parasite Guidelines for Newly Arrived Refugees, why it doesn't have trichinella in it?
Oversight.
Yeah.
I don't know. Would you consider trichinella an intestinal parasite?
It is.
Would you lump it in as intestinal?
Of course it is. It's definitely an intestinal parasite. If they come in with diarrheal disease from places like Laos or Cambodia or China, there are 2 provinces in China right now that have tremendous levels of trichinosis. Hunan and Yunnan province in China.
Who?
Hunan, H-U.
Just kidding.
Hunan and Yunnan. Those 2 provinces, apparently they have different ways of preparing pork than any other parts of China. And as a result, there's a lot of cases. If those people immigrated to the United States after they just consumed their last meal in China to say goodbye to the relatives, they're going to have diarrhea.
Of course.
But it's rare.
All right.
It's rare.
Yeah, no, I was just looking at the document here, trying to figure out why they neglected such an important parasitic disease.
No, it's not a major diarrheal disease-causing agent, but that's the thing. The thing about this organism also is that it mimics so many other diseases. So when you start to develop nausea, diarrhea, and fever, the first thought is food poisoning. Everybody says, "Okay, you're just suffering from food poisoning. This will be over with in a couple of days," and son of a gun if it isn't. And you say, I just dodged that bullet, and the next thing you know, you've got the muscle phase to contend with, and that's even worse.
Mm-hmm.
Interesting. Dixon, I have a book here I wanted to show you. It's called Introduction to Animal Parasitology.
Ooh,
it's quite old. It's written by J.D. Smith, Smyth,
Oh, yes.
in 1962.
Oh, yes.
I just opened it. I wanted to, it's for some other reason I brought it, but I just opened it, and the page is Effects of Reinfecting Rats 40 days after an initial infection of Trichinella spiralis.
I'll be darned.
Oh, that's great.
Anyway, the reason I brought it is because it is signed on the inside by William Campbell, Dublin, August 1962.
Oh, great.
Isn't that cool?
That's fantastic.
That is cool.
That is fantastic.
Do you know how I got this?
From your wife.
That's right. She used to work with him at Merck.
Right.
And I guess he left this behind.
And I was going to say Smith or Smyth, however you pronounce that, is a British investigator, and I actually met him.
Now, if I read this, would most of it be wrong, or would some of the stuff still be
Not wrong. Nothing up to that point was wrong. It's just been added to and embellished.
Okay. So I'll read you a statement here, and you tell me if it's wrong.
No, you can't do that to Daniel. He's more encyclopedic than I am.
I just want to see, genus Toxoplasma. This organism is a mysterious parasite of warm-blooded animals
Not so mysterious
and
anymore.
man, about which so little is known that even its animal nature is suspect. Some workers considering it to be a fungus.
See, at that point...
They've now just embellished upon that.
That's pretty funny. All right. Are we ready to move on? We have an interesting paper.
We have a great paper. Who picked this out? This was a good choice.
I picked it out. I came across it in my literature searches. It's published in PLOS Pathogens. When parasites are good for health, cestode parasitism increases resistance to arsenic in brine shrimps. The authors are Sanchez, Pons, Martinez, Haro, Taggart, Lenormand, and Green from Spain, Portugal,
right,
the United Kingdom,
right,
and France. Wow.
Right.
What an international collaboration.
Right.
Now, this is cool because here we're looking at when a parasite is good for you, and what they're looking at here are brine shrimps and their resistance to arsenic.
Hey, go ahead.
You can interject. It's okay.
No, when you say the parasites are good for health, what they're saying really is that this parasite has a mechanism for keeping its host alive long enough so it's consumed by the definitive host.
Yes, of course. The
so
parasite,
it's not good for the host, it's good for the parasite.
Yeah, the parasite doesn't care. Well, the host is being protected against arsenic killing in this context, right? So the host does. So you think it's all presented in the wrong way.
I do, because if all the brine shrimp died from arsenic poisoning, that would stop the infection, wouldn't it?
That's right.
But it doesn't, does it?
Yes.
So who's benefiting most from this?
Well, I don't know about most in nature, Dickson.
If you're a brine shrimp,
I think they both
what difference does it make? You only live a couple of weeks anyway.
Yeah, I know, right?
But if you only live a couple of weeks, if you get an extra week, that's like 50
an extra
years.
Week is like,
that's like
I
50
agree.
years in brine shrimp world.
This is true,
I
but
think
what it's
you're
really
right.
doing
You know
is...
what? Good for health is that you're right. That's not correct.
That
It's good
isn't.
for the parasite.
Yeah,
they don't give a damn about
that's right.
the shrimp.
This is an anthropomorphic view of...
I totally agree with that because I am very against anthropomorphism.
I do know that. I do know that. And that's really is a value judgment here. What it should say is that there's a very unusual strategy that this particular larval cestode employs in order to keep its intermediate host alive long enough to be consumed by the definitive host, which in this case are birds.
I agree. So the point here was they wanted to investigate possible beneficial effects of a parasite, and in this case, in its response to an environmental pollutant, right? And so they picked brine shrimps, which are Artemia species, right?
Yeah.
Is that how we would say it, Dickson? Artemia?
Yeah, Artemia.
Artemia? Artemisinins?
Yeah, probably.
It says here it's the most important live food used in aquaculture worldwide.
It's true because most of them are tropical
They
fish.
feed the fish with these things?
They feed tropical fish.
It's also really
And they're
key
easy to
just
keep.
to the world, just the ecosystem of the world, not just what we're trying to do with it.
They are dominant macroinvertebrates in hypersaline ecosystems.
Right.
And many water birds eat them.
They do.
All right. And it turns out these brine shrimps are intermediate hosts for many cestodes that go on to birds.
That's correct.
So the birds must eat these shrimps. How would a bird find such a shrimp? These are living in water, right?
Yeah, but they're living in hypersaline solutions.
Yes.
So there are very few birds that actually feed in hypersaline solutions. Name one. Well, you know, because it's in the paper. Yeah, flamingos. Flamingos are all over the world. They're worldwide, believe it or not. And they all seem to have the same feeding habits in the sense that they all filter feed, and they filter feed with their heads down and almost, almost feeding backwards. They have strainers just like balines have for whales.
Wow.
And they strain out the
Now,
algae, or in this case, they're straining out the brine shrimp.
Really? That's interesting.
Yeah, the brine shrimp are so small that they would have to have some
filter
kind of
them out.
mechanism. Like
All right,
that.
so they're not just looking for individual ones.
Oh,
Pick
no,
them
though.
out.
They,
So, Dickson, down the street from my house, my neighbor has some plastic pink flamingos on his lawn. They don't do this, right?
those are probably feeding on microplastic particles rather than...
Now,
So this raises the question also as to why flamingos are pink.
It's interesting. They always say that that's because they eat all the shrimp. And I always envision, like the big tiger shrimp, the ones that you have on your plate.
Yeah.
The ones that when I go
Right.
out and eat Chinese food with this guy, he says, no, I don't want I want those big 5-inch shrimp, please.
you ever go to Japan, in the streets in Tokyo, they grill them. The big ones are like a foot long.
Oh, wow.
And they're on grills with skewers, and you can buy one and
bet.
crunch. Delicious.
Remember, my grandfather was a shrimper, so
Really?
That's why I like shrimping a lot,
So you're
I
a
think.
shrimp son?
I am a shrimp. I'm a
grandson.
shrimp lover.
Shrimp grandson. This is in New Orleans, right?
Yes.
Can you do a good New Orleans accent?
I could if you asked me to, boss.
Is that right? Is that how it goes?
They talk like this sometimes.
And how would that compare to Georgia?
Georgia's totally different. They're just much more different.
That's the same to me.
No, they're slower, first of all, and they say please after everything. Would you like some more of that, please?
You sound like Kevin Spacey now.
No, I don't want to sound like Kevin Spacey. He's
All right,
too
so-
cynical for me.
This study was done in Spain, which is why a lot of these authors are from Spain and Portugal. And this population was at the Odiel and Tinto estuary in southwestern Spain, which is, I didn't know this, you probably did, one of the most polluted estuarine systems in Western Europe.
Did not know that either, but I'm depressed to hear it.
It is full of arsenic,
Yes.
which comes from the ground, I presume, right, Dickson?
It does, but there's another use for arsenic lately, and that is to replace the remnant gold in tapped-out gold mines.
Mm-hmm.
So arsenic replaces gold in terms of the electrostatic forces that each one represents on the periodic table. So it could actually displace gold,
Yeah.
right, and put the gold in solution,
I see.
and the
So-
arsenic goes into the rock.
So if you're mining gold, that's one way to do it. You put arsenic in.
You
Because
do.
they say here that it's both environmental and as a consequence of mining in this area.
That's right. That's right.
You know how much arsenic is transported by these rivers every year?
12,000
12
tons.
to 20 tons a year. Tons, Dickson.
That's right. I know.
My gosh.
Same thing is happening in the American Midwest,
And you know where it
the
goes?
American West. Yeah, into the ocean, of course.
What does it do there?
It disrupts all kinds of ecosystem processes.
Wow. So there's lots of arsenic here.
But it gets
and,
diluted at least once it gets into the ocean.
So you're saying the solution to
Pollution is dilution. Yeah, it's not a solution, but it certainly lessens the pathological consequences.
But if we all get infected with these tapeworms, we'll be fat and happy. That's what I got from this article.
So what is it? So what is it? What is a cestode, Dickson?
Well, it's a whole phylum of organisms.
Mm-hmm.
They're all obligate parasites, and all of the adult worms are found in the gut tracts of various animals.
And humans included.
Of course.
What would you call a human cestode?
Well, Taenia saginata, Taenia solium.
Tapeworms, right?
Tapeworms. They're all called tapeworms.
So here they are called, listen, because they're actually named after the bird,
Yeah.
Flamingolepis linguoides.
Exactly.
Flamingos. And then there's another one, Confluaria podicipina, which infects grebes. What's a grebe?
It's a water bird.
Wow, Dickson.
It eats fish.
All right, so they want to know if having these cestodes in the shrimp affects their sensitivity to arsenic.
Right.
So they basically dose them with arsenic and do toxicity tests.
Right.
And they also evaluate, we have to mention this up ahead, the antioxidant defenses of these shrimps, because these are going to be in play to help you resist arsenic. And they include superoxide dismutase,
Right.
which detoxifies highly reactive oxygen species. This is one of my favorite enzyme names in the world, superoxide.
Yeah, no, I like it.
Sounds like
too. I do like it.
a superhero, doesn't it?
That's right.
Yeah. Well, no, that's the latest thing among the younger generation. When you get in the car, you hear from the back seat, which superhero would you want to be? Because apparently now there's superhero against superhero stuff.
I would want to be superoxide dismutase.
Me too. Me too.
Then catalase, which breaks up hydrogen peroxide.
Right.
And Daniel, I'm sure you remember this, but if you have a cut and you put some hydrogen peroxide on it, it bubbles because there's catalase in your tissues,
Yes.
right? I remember doing that ages ago. I love that. I love it. Glutathione peroxidase, which is a scavenger for a lot of hydrogen peroxide also, and glutathione reductase, which also is involved in combating oxidative stress. Okay. So they looked at not only arsenic sensitivities, but these things as well.
That's right.
And finally, we have to mention T-bars. This is a place you go and buy tea.
That's right.
T-bars. You get it?
I do.
You don't get my joke.
Yeah.
I do. I'll have mine straight up with no ice.
This is called thiobarbituric acid reactive substances, which are mechanisms, which is a measure of how well these other things we talked about control reactive oxygen species. Then they also measured lipid droplets, which contain carotenoids, which are yellow, right? Or orange.
Well, they're orange or yellow.
Almost
They vary.
Well, almost sort of. Well, I mean, what did I take away from this article?
Right. What did you take away?
If you look at Figure 1, you could actually tell which of the brine shrimp are infected with cestodes based upon their color, and these carotenoids actually give the shrimp a red color.
Right. It's beautiful. This figure is going to be our
So all the shrimp that we
image.
eat, is that why they're
No. Don't generalize.
Is that why the flamingos are pink? Are they eating these?
They are.
If the flamingos eat uninfected brine shrimp, do they stay white and not look so pretty?
They do. In fact, and there are some areas of the world where they don't eat them. They eat algae or something else, and they're not pink.
do these cestodes have an effect on the shrimp? Are they negative effect?
Apparently not.
And how about on the flamingos?
Apparently not.
Why do you say that?
No, because most adult tapeworms
flamingos
don't have an effect on the animals that they infect.
That's a wonderful answer, Dickson.
Thank you. So I want you to read the first sentence in the author summary.
All right, we will.
Could become the title of this article.
Virtually all free living organisms are infected by parasites.
Thank you.
And everyone has a
That's
virus,
an
too.
Enormous
Dickson.
statement to make.
It's true.
It's defining life on Earth.
I don't have any parasites.
No, not.
What parasite besides viruses and bacteria, which are not really?
Well, there's the dean.
parasites?
There's the associate dean. There's the.
Wait, I mean, the viruses that are in me are probably commensals, as are the microbiome. So what parasite do I have? Do I have Toxocara? No. Do I have Toxoplasma?
Might.
It's a fungus, isn't it?
No, might have toxoplasma.
I might.
Toxocara is not a fungus.
No, I quoted from the book.
It's a mysterious.
You already
organism.
forgot.
If you eat a little bit of raw meat in your life ever, like a rare steak or something like that,
Toxoplasma.
you might.
Yeah, we say in the U.S. about 20% of the population is infected.
Right.
But it's a latent thing. It's saying, and in places like Brazil and France, like 80%.
France, it's incredibly high.
So back to this, they have a wonderful petri dish with swimming shrimps. Some of them are orange because they're infected, and
Red.
They're red. Okay,
Going with red.
And they are red because they are making lipid droplets that are
response to their infection
that are concentrating this pigment.
Yeah.
The carotenoid,
which is interesting, right? So here you have, I always heard that tapeworms, like you get a tapeworm and then you have to eat so much because you get so thin. And here we have tapeworms
Where
making
did you read
fat.
That? You did not read that in the 5th edition of the parasitic infections.
Wait, this is not true? Tapeworms they don't eat all your calories?
I'm sorry. I wish, maybe sometimes I wish that was true, but it is not true. Of course not.
In this study, they went out in these areas, this river where this terrible arsenic contamination is, and they collected brine shrimp, and they could tell which were infected by the color.
How about that?
And they did verify it later after they did the experiment by molecular methods. But they got lots of different species. And what's interesting is they went out in April, and most of the shrimp had one species, the flamingo cestode. And then in May, was just one. Sorry, in April there were a couple, and in May there was just one. It changed from a couple to just one, which is quite interesting. And then they would take the uninfected and the infected and incubate them with different concentrations of arsenic, which would kill them otherwise, right? And you just look for survival. And they have these graphs here basically showing that when you have these cestodes in you, you're more resistant.
Exactly.
Percent mortality goes down if you have, I mean, it's not 100% protection. It goes like from 80% lethality to maybe 50% or so. But it's an effect, right?
Yeah, it also seemed like it was an issue of, when you harvested these, which cestodes were infected on the brine shrimp. So there seems to be a different protective, are we using the word? Can we say protective? They seem to be better at keeping the brine shrimp alive so they can get eaten by the birds.
Yeah. That's exactly.
So the proportion of infected shrimp with only a single cestode increased from 35% in April to 52% in May.
Right.
And that is it correlates somewhat with the mortality from arsenic. Yep. The LC50, the amount you need to kill 50% of the individuals went up in May compared with the experiment in April. And it's also temperature related. There's the higher temperatures decreased the tolerance of both infected and uninfected shrimps. So that's bad, Dickson, right?
That is.
It's going to hurt this warming, which we know is real, right, of the planet.
Warming is real.
Even though it's denied by certain individuals.
Doesn't matter.
It doesn't matter. You remember what Bill Nye said, why are you the expert, right? It's going to be bad for everybody because the parasite's not going to be perpetuated, the birds, etc. I don't know what the birds like about the parasite, if anything, but do you think they get a benefit, Dickson? Think it makes them resistant to arsenic?
No, but as I mentioned before with that little story that I told you about Yul Brynner, it's possible that the same thing happens in other animals. And so Trichinella really doesn't want to kill you. I don't think any parasite wants to kill you. They simply want you to be able to transmit them to the next host.
I feel like he's anthropomorphizing. Didn't that feel like
yeah, he's right.
Evolution favors that. That's what I'm saying. They're selected for life.
Yeah. I tell you, Dickson.
It's hard to phrase these things so it's not anthropomorphic.
That's the way we look at it, but
I know.
Maybe it's not anything to do with that. We're using human logic, which is all we have, and applying it to these parasites, and maybe it has nothing to do with what we're observing. That's why anthropomorphism is a problem, because it leads you down rat holes that may not have anything to do. It does, but
there's a good example of a trematode their larval stages in the antennae of snails.
Oh, yeah, I remember that one.
Remember that one? And it looks like a barber pole.
Yeah.
And it attracts the attention of the bird away from the normal that don't have them. So they get eaten more frequently than the others. That's a strategy for transmission. Come on.
Yeah, that's what we think.
And so that, I think you're looking at the same thing here.
But I was also, if these brine shrimp that are this bright color have a higher fat content, there may be more nutritional value.
Could be.
But the flamingos really do not have a selective mechanism.
Yeah, no, they're just filtering.
Just the infected versus the uninfected.
Well, they say that it makes it easier for them. They actually say in this paper it makes them more likely to be caught if they're red. But if they're just filtering, that's bogus, isn't it?
Yeah.
Okay.
No, that's interesting. Are they triggered? Like if they notice, the water here is a darker color, I'll go filter feed over it heavily.
Yeah, because you can imagine in a pond there's going to be clusters of uninfected and infected, or are they all going to be mixed?
Of course.
They're
all mixed. All right. Yeah.
So,
we need what we need is a bird expert.
We do.
Where's the bird expert?
Not here.
Tell us about flamingo.
So how does this work? How does the presence of the parasite confer some resistance to arsenic? And so there they look at the antioxidant capacity of the host, and they find that there are higher antioxidants in infected brine shrimp. They have higher levels of catalase and glutathione reductase.
Right.
And so they think that that's probably part of it. And then they also looked at these lipid droplets.
Yes.
Which you can see, and they have some nice photos there. And they estimate how many
They've
are
got
there.
some great photos. I think these photographs are
And these
just
go
beautiful.
up in organisms that are resistant to arsenic. These go up. You get increased number of lipid droplet when you have a parasite there. And so the idea being somehow the parasite must be inducing the formation of these droplets, and that is protective because they soak up toxic things like
Now you got the
arsenic, and then
yeah.
And it's like a log increase. This is not just
Yeah, it's a
subtle,
lot.
going from 10 to up to about 110.
Right.
yeah, it is.
But their
pretty-
implication is not that in the wild, arsenic determines who lives and who doesn't, or the parasite determines who lives and who doesn't, because that's not the case.
right now. Dickson, has arsenic always been in the water even before mining?
Yep.
Yes. Okay. So this is not a man-made
There's a
thing.
ton of, and especially if you go out to places like Bangladesh, there's a tremendous amount of arsenic in the water there. And it's by nature. In fact, we have some areas in the United States that are quite heavily inundated.
Yeah,
with arsenic.
Texas, right? I
Yeah,
mean, so we have
that's
certain areas. Texas has a high arsenic concentration in the water, which is a problem for growing rice, sort of water-heavy crops there. And the Himalayas we've talked about,
Yep.
they have a lot of arsenic in their groundwater from the...
So there's a lot of bioaccumulation, as they call it. And then that, in
Right.
fact, what about the flamingos? If these brine shrimp are more resistant to arsenic poisoning than the normal, and if therefore they can accumulate more without a
Yeah,
side
they're going to
effect,
give it to the flamingos,
then
right?
the flamingos might have an elevated level too. And,
Yeah, they might, yeah.
apparently they're tolerating this quite well.
By the way, I meant to mention that these lipid droplets they contain carotenoids, right?
Yeah.
And they say this lipid droplets in infected brine shrimp are associated with carotenoids, and this, together with hemoglobins induced by parasites, explain the color change that allow us to separate infected individuals. These carotenoids are potent lipid-soluble antioxidants.
How about that?
So they must also be induced by the parasite. Isn't that interesting?
It is. It's an
Something-
indirect effect, but it's still very interesting. That it should favor
Here-
the survival.
Here, listen to this, Dickson. The accumulation of carotenoids in infected Artemia is also considered a parasite strategy to increase the probability of being predated by birds by increasing visibility, but you don't buy that.
I'm not at that level. I think filter feeding organisms like the giant blue whale, the largest organism that ever lived, or flamingos, they indiscriminately filter everything.
But they also say that the carotenoids may enhance the nutritive value of the shrimp,
I would
and
believe
that may
that.
be okay.
Yeah, I'd believe that.
Yeah, I think you're right about this selectivity.
Yeah.
But again, a bird person would be
Maybe
good.
we'll get an
Can you
email,
name a human
actually,
food
you know?
that's rich in carotenoids, as you pronounce them?
Sorry, what do you want me to tell you?
Name a nutritional food that humans ingest.
Carrots.
The carotenoids.
It's not carotenoids?
No, it's
Carotenoids?
Carotenoids.
Yeah, I'm saying carotid artery. That's why I'm pronouncing it carotenoids.
That's
Do I have carotenoids in my carotid?
orange carotids. That's right.
How would you pronounce it again?
Carotenoids.
Carotenoids?
Yeah, carotenoids.
Is it acetyl or acetyl?
Acetyl.
Acetyl?
I think so.
Is it orange or orange?
Stop it.
All right. Sorry. I have acetyl and carotenoids. What did you say?
Carotenoids.
Carotenoids.
Carotenoids. So it's to indicate that it comes from carrots. The color in carrots comes from these compounds.
A temperature increase of 4 degrees caused a significant decrease in the resistance to arsenic. So 4 degrees. So what if we had less than a degree of global warming so far? Is that correct? 2 degrees?
We've got 2 degrees.
So
Prior to the Industrial Revolution to now, it's up to 2 degrees.
It's bad.
I know.
Oh, that's a cool paper. And
Very.
It's good, except for one conclusion, which Dickson disagrees with.
The
And
You didn't
The
like the
title of
catchy,
your
you didn't like the
article.
catchy title?
No, because it's really not a health-inducing deal for the brine shrimp.
For the
That's
parasite.
sure. It's all of this
so
favors
Dickson,
transmission.
any behavioral modification induced by parasite is for the parasite, but it may have
One would assume.
it may have good effects on the host, right?
Like, for instance, remember the paper we discussed about toxoplasma
Mm.
and its interruption of the ability of a mouse
Yes, to be afraid
smell
of cat urine,
cat urine.
to smell cat urine, or the enhanced immunity conferred by Trichinella, which you just described,
Yeah.
right?
Yeah.
Okay. All right. Do we have another case study?
And by the way, there's nothing wrong with a parasite having a dual effect. One is
wrong.
that it extends your life and makes it better, but it also extends their life and makes it better. You can do both of those.
Yeah, we're not talking about value judgments here. We're just talking about how to word it.
Yeah, that's right. That's right. This is a plus pathogens, I guess, paper that they just thought it was okay to call it
It's
that.
funny that's in plus pathogens, isn't it?
Yeah.
Because this is a pathogen of shrimp or not of people usually.
Well, that's
But
No, I thought it was a good paper, and I sort of jokingly made that comment. There's that misconception in the world, right? That when a human being has a tapeworm, that somehow it's sucking the calories out of them, and they're not. I mean, the amount of nutrition that an intestinal tapeworm in a human being takes out of our diet is really negligible. And here we're seeing actually the host getting fat, getting more lipids, living longer.
By the way, I forgot to mention that.
So now when I see someone who's overweight, I might say, "Hey, do you have a tapeworm?"
And he just nudged me, by the way. So just know that even though this is not on television,
nudge, right?
I'm sure.
Listen, I have to mention this. I forgot to mention it, and I wanted to.
Yes.
Right, let me get back to the paper here. I'm sorry. Forgive me while I get the paper. Here we go. They this is very cool. So remember, we said these infected shrimp had a higher number of lipid droplets, right?
Right.
Yes.
Which they think protect the host, and they say this is the principle of survival of the fattest.
But
I like that. That's good.
I thought that was funny, don't you think?
Yeah.
And I thought that could be a title of this episode, if anything. It's survival of the fattest, or I also like trichinosis is the diagnosis. That's another good one.
Oh, that's a good one too.
All right, let's have a case study.
All right. We have a 32-year-old male who comes in with several concerns. He reports that and I will say this is an actual classic parasite, just to put it out there for people. But I do suggest in the future that maybe we'll stray into a parasitic disease that's not necessarily a worm. But this is a 32-year-old male, comes in with several concerns. I would say concerns, not complaints. Not complaining. He's there for our advice regarding his concerns. He reports that he had spent 6 weeks doing religious missionary work in Western Kenya, where he performed baptisms in Lake Victoria. He took daily malaria prophylaxis prescribed for him by his primary care physician before departure, took Malarone, and he ate lots of interesting foods. He reports that about 5 weeks after he got back, he developed a rash with fever and some shortness of breath. He called his 4 friends who went with him and asked them how they were doing, and 3 of the 4 friends reported similar symptoms. Prior to this, he said he was a healthy guy with no prior medical problems, no surgery in the past. He doesn't take any medications. He's not allergic to anything. We can always get some questions on toxic habits and other things from Vincent coming up. So should I pause at that point before we go ahead and get a little more?
You have to be near the mic, dude. You can't do that. Come on, pull it. It's going to be a lot of extra work for me to edit.
I wasn't about to ask a question. I was waiting for you to.
But you're talking. And
only to you, though.
Yes.
So you're going to ask, does he have any unusual sexual behavioral patterns?
I'm going to get to that. Now, this guy is a religious mission. Is not a priest.
Doesn't matter.
Or a man of
Doesn't
church.
matter.
Does he? Is he married?
He is not married.
So he's in his. Of what sexual persuasion is he? Is he
with whom does he have sex?
Men who have sex with men
or women?
Women or what? What is he?
He has sex with women.
Okay, and did he have any on this trip?
You know, this was one of those like embarrassing moments for me. It was 2 weeks ago when I'm about to start back on the wards again, and the head of medicine, I say hello. You know, we've met before. He goes, oh, I remember you, Dan. You're the one who told me that everybody has lots of sex when they go on vacation. I was like, okay, I'm glad I'm remembered for that. But that's actually a good point. When people travel, there tends to be an increase in the amount of sexual activity that occurs. So yeah, there was some sexual activity while he was overseas.
What did the other 3 have in common with him in terms of their behavior? Were they baptizing people also?
Three of the friends were actually in the water with him, helping perform the baptisms. They also were, I guess, more adventurous in the eating, as was this gentleman. The one friend who did not get any of these symptoms was a little more cautious. Not only was he not going in the water, but he also said that he was very careful in his eating habits. That was actually the one guy who ended up with traveler's diarrhea on the trip.
I was going to say.
All right,
doesn't often work.
But as far as the sex goes, was it protected? Did we know?
He's not clear about that.
Now, when he went into the water,
yes,
was he barefoot?
He took off his shoes and socks, and he was in about waist deep.
Waist deep.
And what they did is they were performing these baptisms for the local people, and it was a full immersion baptism.
Right.
Waist deep in water. That's the name of your book.
It is, actually.
All right. Waist deep in water.
Book.
And he was in probably for an hour at a time, right?
Or more.
Well, it was the one day when they did all these baptisms.
And did any of these people who we baptized get ill? Do we know? Or
we don't.
We don't know.
I mean, it's weeks after he gets back.
Yeah, I got it. Okay, just a shot. Now, when he was in the water, did his hands get wet? I presume so. Yes. And then does he touch his mouth with these hands, do you think? Or
I see where you're going with that.
Yeah. No, that's an excellent question. And I'm sure he did.
Okay. We have to assume contamination, right? And then afterwards,
This is Lake Victoria. It's a lake.
I know about that lake. lots of cichlids. It's one of the oldest lakes in the world.
Are they still cichlids?
Because that's millions of years old.
Are the cichlids still alive? I thought they died off.
No, they're fine. But they introduced Nile perch. So the Nile perch are eating the cichlids.
So it's a kind of a modestly saline lake, right?
No, it's fresh.
The cichlids need a little bit of salinity, more so than I used to grow cichlids.
But hey, wait a minute.
And they need a little salt.
There are various kinds of cichlids. Where did yours come from?
Lake Victoria.
It did?
I'm going to Google it.
The salt requirement in the cichlids.
Well, I don't have. It's not a salt lake. It's a lake.
Okay, well, I'm going to give you guys a little more information while you verify the salt, the salinity requirements of your cichlids.
That was to allow the brine shrimp to survive.
Because a couple of things are going to happen here. He's going to see a first physician who's going to tell him something, and then he's going to Google, and then he's going to see another physician. So he goes and sees the same primary care doc who gave him the malaria prophylaxis. And he goes and sees that doctor when he initially has these concerns. And his vital signs are good. He's not having a fever when he sees that first physician. But he does have an elevated white count. His white blood cell count is elevated at 28,000. And are you ready for this? This is a little bit shocking. 70% eosinophils.
I'm not surprised at all.
70%. That's a lot of eosinophils.
I'm not surprised.
So people can pull out that eosinophilia differential again.
Right.
And he had actually a chest x-ray as well as a chest CT.
Wow.
Which showed some nodules in the lungs. And the doctor told him, this is probably something allergic. I think you will be fine. Go on your way.
My goodness.
And several weeks later, he's Googling on the internet because something just doesn't seem to be sitting right with him. And he becomes quite concerned, and he goes and sees the next doctor.
So the original CT was done here after he returned, right?
So this is weeks. So he develops the symptoms after 5 weeks. He then goes and sees the doc, gets the scan, and now several weeks after that, he says, this doesn't sit right with me. I've been Googling. Stuff has been coming up on my Google searches that concerns me. I'm going to go see somebody.
How's his fever, by the way?
So his fever's gone at this point. He's actually feeling better.
And how about his friends?
So his doc was right. He got better. He's feeling better.
And his friends?
His friends had a similar clinical course.
Thank you.
A little milder than he seems like his symptoms were the worst. But then he's
70% eosinophils.
That's a lot of eosinophils.
That's right.
That's a bucket load of eosinophils.
Yeah. So we're talking like 70% of almost 30,000. That's like
over.
Rash? It's like over. It's like 20,000 eosinophils. That's a lot of eosinophils.
They're punching them out. Bone marrow can't keep up.
That could just be a red herring, right?
Ooh.
A red cell herring, but no.
His rash is gone too, you said.
Now his rash is better and his breathing is better.
His breathing, everything is fine now. He's just got a lot of eosinophils.
He's feeling better. And well, we don't know. We haven't rechecked his eosinophil count. We just know that at this point he's Googled stuff. He's feeling better, and he thinks I should go see somebody.
Why would he do that? If
I should go see like a doc that knows about overseas tropical diseases because I'm worried that I might have one.
That's a good thought.
That's what he's thinking.
And
his doc refers him to a specialist. And next session we will hear what the specialist tells him.
okay.
Mm-hmm. A specialist in tropical medicine.
We don't have any more lab results.
It's all you get.
Can we revisit some other things now?
Yeah, let's ask some more questions because I don't think you guys asked enough about the diet. What he ate.
Yeah, I was
going to
say I want to know what the guy ate. I don't like the water. I think the water is a little bit of a red herring, but or maybe it's a cichlid herring. Who knows?
Well, the water. I should mention a little more about the water. Now, this water that he goes in to do this is right near a village, and there are animals near the village. There also are rodents near the village. I think that's important. The other thing I will mention is there have been some recent rains.
So there's runoff.
I think so. There has been some runoff into Lake Victoria.
That would dilute the salt water for your cichlids, by the way.
Yeah, so we don't have to worry about the arsenic. It's all diluted.
This is in the Rift Valley, the Lake Victoria?
It certainly is.
The Rift Valley cichlids are all freshwater.
I know
You're right.
that, Vincent.
So there is, but when I bought them, the guy said you should put some salt in.
Because they're not from that area.
No, they were from Rift Valley.
They are?
Yeah.
Then your friend was
Is Malawi Rift Valley?
Yeah.
Wasn't my friend. He was a guy who sold it to us.
Yeah, well, that's once they're yours, it's your responsibility.
Well, in fact, online people are talking about salt or no salt with respect to cichlids. But shops add salt for two reasons. The stock in a shop's tanks is constantly changing.
Yeah.
So they have reasons for adding salts. But not all African cichlids will tolerate salts. Rift Valley will, but others may not.
This is probably to keep down the Ictalurus-like diseases.
Let's do This Week in Cichlids.
Go ahead. No, wait. We're learning about flamingos.
Well, if you publish an article on it, you could have called it an enciclid.
I want to know. So you said he ate lots of interesting foods, like what?
And should we mention to our listeners who are not familiar with cichlids that those are a type of fish?
Fish.
They are. He could have eaten some.
Beautiful fish.
And tremendous varieties.
Did he eat cichlids?
So, cichlids, the actual fish, are a common thing to eat in this part of the world.
They are.
So he ate a bunch of interesting things. So he did eat cichlids.
Right.
They're cooked?
They're cooked cichlids. I don't know if there's any people that eat raw cichlids. I don't know if it's something that gets
don't know that.
eaten.
Or pickled
yeah.
We don't know.
All right. What else did he eat?
He had, as he mentioned, he ate a lot of the local stuff. There's this, it's a white, it's called ugali. It's a white corn-based food that they eat, and then they
in that area, didn't you?
Yeah, and then they flavor it with different things. So you might mix it with some greens, and then you put the cooked fish on top of it.
Right.
But it's cooked, right?
It's cooked. They also like to make a stew that has some sort of meat in it. I'm not sure what's in it.
It's cooked, right?
That is cooked. I don't actually think that in this area raw food is particularly popular in any way. No. So the only issue that we might be running into is, was the food all well cooked? Mm-hmm. And some of it's beef, but also goat is eaten in this area. So he's having foods prepared by these local people who he's baptizing. Mm-hmm. And we know that some of the food is beef, some of it's goat. We're hoping it's well cooked.
Do they have sheep in this area? No, probably not. They do?
They do.
Did they eat any sheep?
No mention of any sheep, but lots of goats. He saw lots of goats.
Right.
Okay.
Sheep are more northern Kenya, towards the Tanzania border, or towards the Somalia border, sorry.
So now, he was there with four colleagues, right?
Yes.
And they all did baptisms?
As mentioned, there was the one person who...
Did not?
Did not.
And
that was the one person who didn't get sick, but that's also the same person that was very careful with their eating habits. So this one person was sort of an outlier. They didn't eat much of the foods of the locals. They didn't go in the lake.
Okay, I got it. It's very interesting, Dickson. What do you think?
What do I think?
We need to have more questions.
Am I allowed to stay?
No, we don't want to guess, but I want to know
Do you have any other important questions?
I would just like to know what the lab results were after they went to another person.
Did he have periorbital swelling?
No, nothing like that.
He had a rash with fever, Dickson.
I know all about that part.
Is that telltale?
For me, it is.
Oh, good. Are you enjoying this?
I love this. No, this is a revisitation of my teaching. I love it.
Did you ever do case studies?
All the time. In fact, that was the lab.
Where did you get them from?
From here.
Oh, actual cases.
Harold Brown and others had collected numerous cases. Yeah. Michael Katz. And unfortunately, the course isn't ongoing, but Daniel would have been a major contributor.
You need to stay on mic. You know what that means?
I'm on mic.
Your mouth has to point to the phone because when you go left,
let me ask
I can't hear you.
Have I ever gone off for you?
What do you mean gone off?
Mike?
Yeah, you've been today a few times because you're looking at Daniel.
Well, I'm trying to be...
But you can't look at him.
I'm trying to be
we got to get
social.
that round table.
I need a round table.
Where we're all equal.
I
Some
think you're
more
right.
equal than others, but still.
The Charlie Rose approach.
I agree. I need to get a round table. And
well, we can solve that.
We'll maybe King Arthur will come with it.
Perhaps. Or Guinevere, maybe.
That would be more interesting for me, but maybe not for everyone. All right. That's good. I'm good with that.
Yeah, me too.
All right. We have some letters. Shall we read them?
I guess.
Fantastic.
You guess? There are 4 or so, 5. Well, we'll see how long they go. It's 5.
We try to find them first.
The first one is from Johnny. Now, Johnny, just to let you know, Daniel, is a pediatrician in Cambridge, Massachusetts, who writes us often on TWiP.
Oh, okay.
And here's her first TWiP letter. Dear TWiPanosomes, ran across this and thought of you. And she sends a link to a TED Talk by Jaap de Rood. How parasites change their host's behavior. How about that, huh?
Oh, wow.
Just right up the alley in what we're talking about today. And she writes, I am trusting TED Ed to have had their science facts checked and verified. Is that true, Dickson?
Sometimes they do.
Personification alert. Note, there has been shameless and wanton projection of human behavior and intent on the viruses and parasites portrayed in this video. So these are 2 things we just talked about. Changing behavior and anthropomorphism.
Good follow-up.
Thank you very much. Dickson.
I wish. I lost the website.
Well, you can read. Let me help you out there, sir.
Thank you so much.
Alexa writes.
This is Alexa. I was referred to you guys from a listener and fan. I was wondering if you could tell me anything about Chagas disease and the Triatomanae insects that carry it. I rescue...
What episode was that?
Oh, that's right. What episode was that?
I'll look it up.
It continues. I rescued a pregnant dog from a shelter who had 4 puppies. 2 of those puppies died suddenly, no symptoms or warnings. One was only 8 weeks old, and one was just over a year old. I had the other 2 pups, now in other homes, taken to a cardiologist to see what we could learn, and one of the siblings showed some minor heart abnormalities. I'm in Texas, so I'm assuming the cardiologist knew from experience what this looked like, and had that dog tested for Chagas. The test tragically came back positive. I'm working on getting the mama dog, who I still have, and the remaining puppies tested, though based on what we know, it is strongly believed that mom was the vector and passed the disease in utero to the puppies. As I understand it, there is no quotes-unquote cure for Chagas in dogs, only experimental treatments, which I am pursuing. I wanted to know if you knew of anything regarding drugs or treatments that are being tested besides the standard drugs like benznidazole or nifurtimox, which are not available for veterinary use unless they are approved by the CDC for investigational protocols. I was also wondering if you know anything further about transmission. I was told by my vets that the dog-to-people transmission has never been documented and extraordinarily unlikely. I was also told that there was no known cases of dog-to-dog transmission outside of a pregnant mother to pups. But is there any actual data on this? Would it be possible? I know it can be transferred from people if they eat contaminated animals or through blood transfusion. But what about casual contact with animal blood? I helped this dog give birth to her puppies. I have had contact with her blood, and I'm sure at one point or another, the other dogs in my house, unrelated to her, have too. I really appreciate any information you can share. This is devastating to me. The first puppy died, which was still in my care, and the second was actually a puppy I ended up keeping. I love all of these dogs tremendously, and I am terrified of losing them. Thank you so much, Alexa.
It was TWiP 15, trypanosomes.
Yeah, well, these are interesting times we live in, and that certainly is one of the more unusual concerns that I've ever heard of from a parasitological perspective. I think, were you wearing gloves when you delivered the puppies? Did you create a barrier between you and the puppy blood and the mother's blood when they delivered? And that's question number one, of course. And then if you did, then the chances of actually contamination are low. But if you didn't, and if you had little nicks or cuts on your hands, then I obviously think that there was a remote chance that the trypanosomes could have gained access. And I don't know what else to say except to, periodically have yourself checked at a physician that knows something about Chagas disease. And there aren't very many of those in the United States, unfortunately.
Yeah, Alexa, what
would you say, Daniel?
Yeah, no, this is a sad situation. Now, there are some positive aspects, which I'll go ahead and say. One is, at least from our experience with Chagas, is it's usually the minority of infected animals that end up actually getting sick, getting manifestations. There's a strong desire to treat, to cure this disease. And what we're actually seeing, and this is maybe unfortunate, I guess, is that it's not clear that even our treatments, our CDC investigational protocols with benznidazole or nifurtimox necessarily have dramatic impacts on disease. Right. There was a study that was published, I think, in the last year in New England Journal, where they looked at people that were symptomatic. So they're thinking these are the people where we're going to see the difference. Yeah. And there actually was not particularly impressive results from that study. So a lot of ways it may be a watchful waiting approach. These drugs are poorly tolerated. They're fairly toxic. I found it actually difficult to ever get anyone through treatment with these medications. So it's going to be hard in a dog. But here's what I'll say is positive is I think the chance of a person actually getting Chagas disease from these infected animals is incredibly low. Right. If you look at the number of cases we've seen in the U.S. of Chagas disease, there's the one story of the guy from Montana who was down at summer camp in Texas, and we think there was some sort of a vector involved. But otherwise, the number of actual documented Chagas transmissions in the U.S. is pretty minimal. It's
through transfusion mostly.
Yeah, it's through transfusion. It's through the vector intermediate, but not directly. And now, when the blood to actually go ahead and infect yourself, even through a break in the skin, I don't think that's actually ever been reported in the U.S. And we know that there has been Chagas in dog populations. There were the outbreaks in Tennessee, I remember. So I think one of the nice things is I have to say, like, your risk of getting Chagas from these puppies is incredibly small. And you don't need to wear gloves. You're not going to interact with a puppy and wear gloves. The puppies are going to chew and they're going to do the rest. But I have to say, the risk to you from getting Chagas, I would have to say, is incredibly low.
May I respectfully disagree with you?
He's going to disagree over here.
Just with the Tennessee outbreak, that was actually leishmaniasis.
Was that leash? Did I
confuse that was leishmaniasis. And hunting dogs. Yeah.
So what was the Chagas outbreak in dogs that we had in the U.S.? There was a Chagas outbreak.
I don't recall one, to be honest with you. So you might know something more about that than I'm aware of through the literature. But I think the outbreak that you were just referring to was a hunting dog that was brought from the Mediterranean basin to a place in Tennessee, and then they spread the infection to other hunting dogs at that point.
Yeah, I was checking it here. I think Vincent can look at it. I don't. So what was it? Louisiana was where the outbreak was. So there's been a few issues down in the South.
Yeah, I mean, we have the vectors. The dogs have the infections. But remember what we said about the vectors in this case. The vectors, unlike the ones in Central and South America, they don't defecate before they as they're biting. So the only way to catch it is to actually eat the vector. And animals tend to see them on themselves, and they grab them and bite them and kill them, and that's how they get infected. And humans just don't do that.
Yeah. Yeah. No, I mean, and that actually is the major sort of this oral transmission. But I think the caveat I'll throw in is that, I'm a human doctor, not a veterinarian.
Exactly.
So, as far from a Chagas expert in dogs, but yeah, and I hope your dogs do well. It's tough.
it's a long sequelae. I mean, this infection takes a long time, even in people. So maybe your dogs will outlive their infections simply because dogs are not that long-lived to begin with.
Yeah, I found an article on dog infections by Trypanosoma cruzi, and they say a bite or dogs can eat the bugs.
Exactly.
It can be transmitted congenitally through blood transfusion and through transplantation.
Right.
Chagas became a reportable disease in Texas in 2013, relatively recently.
Very interesting.
Okay. The next one is from Esper. That's your turn, Daniel.
Esper writes, by the way, huge mistake, egregious error, after an egregious, in TWiP 104, La Maladie des Sommeils. Wilson was born of a volleyball, not a basketball as mentioned, picture attached. I could tell it was a volleyball during the movie since it is a world-recognized sport as opposed to some strange sports you play in America. That was from Esper. And we have this nice picture.
Yeah, that's true. That's definitely Wilson.
Wilson.
Why was it named Wilson?
Because
that's who made the volleyball.
Yeah.
Is that true?
It's an American manufacturer.
It had Wilson written on it.
It's an American manufacturer.
Yeah.
So take that.
Esper is actually, let me tell you this, Daniel. He writes to TWiV. He's an infectious disease physician in São Paulo, Brazil.
Oh,
and he's written to us a few times about the Zika outbreak, and is actually going to be a guest on TWiV in a couple of weeks.
Oh, nice.
Oh, that's great.
Bring him in by Skype.
Nice. Well, tell him from the World Cup of last time, you should know that the United States now does play play soccer fairly well, by the way.
You mean football?
Football. Yeah,
Football.
football.
The last one is from David, who writes...
Can I read the David one?
You can.
He's going to harass my buddy.
Go ahead. Go ahead.
David writes, was just listening to TWiP 104 again, and I overheard Dr. Libman mentioning that Belgians worried about the health state of their slaves because sleeping sickness would not get them safely across the ocean. Being a Belgian by birth and having studied the history of the Congo somewhat extensively, I need to point out that this is not quite correct. Slavery had already been abolished in the U.S. 20 years before Leopold II surreptitiously, can you pronounce that? Surreptitiously snatched the huge territory of the Congo from under the nose of the British and French contenders. Free State Congo remained personal property of Leopold II until 1908. No slaves were exported in these years, although the period was particularly brutal. Leopold II was desperate to recover his investments, and the few mercenaries on the ground who oversaw operations did everything necessary to increase rubber production, the bubble commodity of the era when bicycles were just gaining momentum. They famously cut off hands of slaves resisting forced labor. I know it's a detail and that science and not history is the protagonist in TWiP, but this seemed like a flagrant misconception. Kind regards, David. And we mentioned that this was forwarded to Michael Libman, and we have his reply.
We have a rebuttal.
So Michael writes, my bad luck to have a listener interested in both parasitology and Belgian colonial history. I was actually going to interject that this is good because next time Michael gives a lecture, he'll update it and actually he'll include accuracies instead of inaccuracies. But anyway, so my apologies to him and to Belgians in general for the error he points out. While the brutality inflicted on local workers under Leopold, particularly in the rubber and mining industries, has been well described, accusing the Belgians of complicity in the slave trade was certainly incorrect. The relationship of colonial-era healthcare and trypanosomiasis is still quite interesting. It is clear that at the start of the 20th century, as French and Belgian healthcare workers established themselves throughout West Africa, they found that trypanosomiasis was rampant and decimating the indigenous population. The reasons for this are speculative, but likely involve earlier population movements related to both the slave trade and developments in the forestry, rubber, and agricultural colonial industries. We presume that this led to movement of non-immunes into endemic areas and perhaps enabled spread of tsetse flies into new habitats. The colonial powers, first France and later Belgium, became interested in mass control programs, primarily as a way of protecting their labor force, but also to protect expatriate Europeans. Among the first was a French military doctor named Jameau, who made an incredible contribution to controlling this disease in French Central Africa and Cameroon using injectable arsenicals. The medication sometimes killed individual patients, but was very successful at reducing the human reservoir.
The parasites, too.
And of course, it's going to reduce the human reservoir, right? Particularly everyone you killed.
Yeah.
But okay, I'll continue to read. Between 1917 and 1919, Jeannot examined almost 90,000 individuals, diagnosed and treated over 5,000 cases, all with exactly 3 microscopes and 6 syringes. Okay, I'm cringing now. He used 6 syringes to
Look at
to
AIDS epidemic.
inject
Maybe it started a lot earlier.
90,000.
It did.
Okay.
No, this is thought to be what catalyzed it for sure.
Well, his team traveled largely by foot from village to village. Some of his European colleagues succumbed to the disease and published the progression of their own symptoms in journals.
Yeah, that's true. That is true.
The Belgians were a bit less organized in this respect, and trypanosomiasis control was undertaken by physicians working not only for the government, but also for the private industries, missionaries, and philanthropies. From 1910 to 1940, the number of doctors in the Belgian Congo increased from 47 to 302, with particular directives for treating trypanosomiasis as well as yaws and syphilis. After the war, Belgium, perhaps moved by a sense of moral debt toward the Congo, invested heavily in healthcare with over 10% of the colonial budget dedicated to this area. In 1958, the colony had 2,815 health institutions of various types, with 85,000 hospital beds, probably more than the rest of colonial Africa combined. For those interested, I actually stole much of the above information from a fascinating book, The Origins of AIDS, by Jacques Pepin. Indeed, the study of parasitology is intimately intertwined with human history. Thanks again to the listener who gave me another opportunity to prattle on, Michael.
He prattles very well.
So the original letter from David had written the earlier very long letter where he made some guesses about the case study. So he had sent 2 here.
All right.
And so this book, the Origin of AIDS, is very good. And in fact, it's thought that this use of 6 syringes in 90,000 people, in fact, contributed to the spread of AIDS. And then what happened, of course, Congo obtained its independence in the 60s, I think, and the Belgians left. The Belgian physicians left, and the Congo was in trouble. So they reached out to Haiti, who had French-speaking physicians, and they came and worked for a number of years, and that was thought to spread HIV back to Haiti.
Yeah. No, I've read this. Is a great book. I've read this book. I would recommend The Origin of AIDS.
Wow. It's great. It's absolutely great. All right, that'll do it for TWiP 105. You can find it at iTunes and at microbe.tv/TWiP. And do send us questions and comments and guesses to our clinical, what do we call them, case reports?
Yeah.
TWiP at microbe.tv. Daniel Griffin, who does these wonderful case reports, is here at Columbia University Medical Center. Thank you, Daniel.
Oh, it's always a pleasure.
Dickson Despommier is also here, where he is an emeritus professor of microbiology and immunology. You can also find him at the website, Racaniello.org,
Soon to be reorganized.
Which we should fix. Thank you, Dickson.
You're welcome.
I'm Vincent Racaniello. You can find me at virology.ws. The music you hear on TWiP is composed and performed by Ronald Jenkins. You can find his work at ronaldjenkins.com. You've been listening to This Week in Parasitism. Thanks for joining us. We will be back soon. Another TWiP is parasitic.